going to be inserting a Foley catheter in a patient. Prior to actually doing the procedure, you want to check your doctor's order, have an understanding as to why you're putting the Foley in, gather your equipment, and wash your hands, provide privacy, and explain it to the patient. So I'm going to go into the room. Mr. Jones, your doctor has ordered me to put in a Foley catheter into your bladder, which is a tube that's going to go into the bladder and collect the urine. Do you have any questions? Okay. Let me just check your name back. All right. Are you cold or unusually cold this morning? No, you're good? Okay, so I usually just use the top sheet and bring that down. If I had a patient who was cold, I would go get a warm blanket, or I might use the bedspread. If I had a patient who was very concerned with privacy, then I would probably cover the legs more. And the first thing I'm going to do is get my patient in the position that they need to be. So for a female, you're going to, maybe I can have a little help. Terry can come help me. We're going to put her in the lithotomy position. Okay. And I'm going to make sure that everything that I need is exposed. And you could just tilt the head up a little bit, or you could lay the head down flat. And I've got my kit. I want to make sure that everything's in this kit, because kits come differently. This one happens to have the collection bag in it. Some of them don't. So you need to be familiar with the type of equipment. So this is just a Foley catheter without the collection bag. So look carefully at the outside of the container so you know how it opens. There's usually a very easy way to open it. If you try to do it another way, it won't open. So you're going to open that up. You take it out.
Use that for waste.
And when you open your package, the most important thing while you're doing this is to maintain sterile technique. So I'm going to open the package away from me, and then to the sides, and toward me. Remembering that an inch on the perimeter of this is considered sterile. Now the first thing in here is my sterile drape. So I'm going to pick that up by the edge, try not to touch the container, and I'm going to open that up. And Terry, if you wouldn't mind just lifting that back. And I'm going to insert this underneath the patient. Okay, down you go. I like to have that sterile drape there. I'm not as concerned about my linen. If I'm concerned about the linen, protecting the linen, I put a Chucks there. But I want a nice sterile area. Then I'm going to grab my gloves, touching the outside of the package. I'm going to come off to the side and open my package up. And I'm going to try to not open it up onto any part of the sterile area. So I'm opening that up. Sometimes this package has a tendency to not want to stay open, and so put a little crease in it. I'm going to grab the inside of the glove, lift that up from my sterile field, and insert my dominant hand into that. Okay? Then I'm going to take my hand with the sterile glove on it. I'm going to touch the outside under the cuff of the other glove, and then I'm going to insert my hand. Now that went on nice and easy. Sometimes your fingers get messed up, and you could always, after you put both gloves on, fix the fingers. So now I have a fenestrated drape. On a male, I always use this. I don't always use it on a female, but since we have it, I'm going to go ahead and apply it. And again, I only want to touch the drape. I do not want to touch the patient. Now I have the inside of my kit. I've got my sterile drape underneath it, and on top I have my betadine. I'm going to go ahead and open this up and put it on my cotton balls. Sometimes it's good to sort of separate the cotton balls a little bit.
It's a real good tip.
And sometimes you might want to leave one of them not so saturated in case you need to visualize it a little bit better, because sometimes the betadine will obliterate the urethra. It'll be difficult to see.
And when you open up that betadine, be sure that when you pour it, it doesn't pour out all in one place. So gently pour it and maneuver it around all the cotton balls.
Okay, I have 2 syringes in this kit. This happens to be the water-soluble lubricant. It doesn't always come in a syringe, so you just have to be sure which is which. And this is my sterile water. So now I've got my balloon, my catheter. I'm going to go ahead and take it out of its package just so that you can see it easily. And I'm going to check the balloon. You note how carefully I took it out so the catheter wasn't flinging all over the place, possibly getting contaminated. I'm going to attach this to the balloon port, and I'm going to check my balloon to make sure that it inflates.
It's not leaking.
It's not leaking, and it deflates completely. And it did that nicely. Then I'm going to take my lubricant, and I'm going to put it right here, and I am going to lubricate the catheter tip. Okay, now I'm ready to go over and do this on the bed. You can set this, I could have done all this right between the patient's legs. You have to assess the patient to see if they're able to tolerate having their legs separated for that long, how much they move, how cooperative they are. And so at this point I'm going to bring everything over. I'm taking my sterile package over to my sterile drape. Okay, so Terry's helping me hold the leg. Lots of times I'll let that patient's leg lean up against me to sort of support them. If you have a patient with an epidural, for instance in labor and delivery, I prop pillows underneath the legs so that you don't hurt the hip joint. Okay, so the first thing I'm going to do is I'm going to cleanse the patient. And now my left hand is becoming contaminated. And I'm going to separate the labia so that I could visualize the meatus. And you need to be very, very aware of where it is. Sometimes you need a flashlight to actually locate it. It's very easy on the mannequin because there's a hole, but in reality, it isn't that easy. All right.
And I recommend that you use the flashlight from the hospital and not your pen light. It'll give you far more light, especially in a room that's not lit well. And here's your bag.
Okay. Now, you got to really have your hands on separating the labia here. A little hard on this mannequin. All right. So the minimum number of swipes you want to make are 3. Sometimes you think, oh, well, I didn't really get that good enough. I'm going to use all of them. So I'm going to go down the left. Down the right. And down the middle. Okay, well, I think I could do that a little bit more better, do it better down the middle, so I'm going to do it one more time. Okay, now I'm ready to insert the catheter. All right, you could take a deep breath.
Deep breath, bear down. There you go.
Okay. Now, take that. Okay. Now I'm getting urine now, so I want to insert it another 1 to 2 inches. And once I'm sure that I'm in there, I'm going to inflate my balloon. I'm going to pull back until I get resistance so that I know that it's in there.
And notice that Jennifer kept her hand there. You don't want to let go of the catheter because it could slip right out.
Right, and you don't want to let go of the plunger either,
Yes.
because the water will start coming back. And then I disconnect the syringe from the catheter kit. I'm in now. I could let the patient know that. And I'm going to clean up the patient. I might need to do some peri-care at this point. And I'm going to bring my catheter. In this case, I have a Foley stat lock. I'm going to just connect it right into there. And then I'm going to bring this down to the side of the bed. I'm noting the color and the amount of urine that I got. And I'm going to document that I inserted it, the type of catheter that I put in, and how the patient tolerated it, and the type of urine that I got back.
If you don't have one of these devices, you can also use tape, and just make sure that you tape it well to the leg and give the patient some room between the tape and the tip of the catheter there. And also this little clamp here, I like people to use it, and they can clamp the tubing in the bed with the patient and use it in its natural turn. Don't make it go differently than it's naturally turning. And then you will find hooks on the gravity bags, and then once you, usually it's here in the middle, bring that up. This way we'll find, there we go, and we'll just then hook it right here. Down
Onto the bed frame.
to the bed frame, and you can find hooks underneath all the beds. All right. Very good.